If you work in PR, one of the most difficult things is to explain to your parents what you actually do day to day. Chances are that your mum probably thinks you work in corporate journalism or some part of advertising. And so today I'm going to turn that around. I'm going to focus on my family and my mum and dad in particular, and I'm going to explain what goes on in healthcare PR. So here are my mum and dad, Bert and Mary, and here's my dad, Bert, watching TV. And there's something on the news there, something about a medical breakthrough, or there's hope on the horizon, or there's certainly something health-related going on.
3 years ago, Meredith McDonnell was diagnosed with breast cancer, but a new chemotherapy drug is giving her hope.
At the present moment, it is keeping me alive.
Back home, relief at last for anyone with the common and troubling skin condition psoriasis.
A revolutionary new pill called Strattera is helping thousands of Australian children to lead normal lives.
Chances are there's a PR consultant who's playing a very important role as a conduit between the manufacturer and the media on those kinds of stories. Their key role will be to advise on the news value and the framing of the announcement, check the media materials and the approach are consistent with the various regulatory codes, work with the hospitals and the patient groups to source appropriate patients who are prepared to act as case studies. That's important in trying to personalise the story. And then liaise with the journalists, manage the exclusive arrangements and oversee the interviews and all of the filming. So as you can see, the PR consultant plays a very important role in determining what Bert sees on the evening news. So let's look at another key family member, my teenage daughter Amy. So like most teenage girls, she's very interested in personal hygiene and she uses a mouthwash. Well, no real surprises there, but now there's something in the media that seems to have got her attention.
They promise to protect our mouths from disease, but tonight there are claims that mouthwash products could lead to cancer.
So what role might the healthcare PR team have in dealing with something like this? Well, you can bet that they're working behind the scenes to do a number of very important things. Respond promptly to media inquiries for comment, coach interviewees on techniques and messages, secure independent support for the safety of their product, and make sure the messages conveyed here in Australia are consistent with the company's global position on the issue. And they'll be issuing information to healthcare professionals like pharmacists and dentists to keep them in the loop as the issue rolls out. The aim, after all, is to try to mitigate the impact of the issue and return the business to normal as quickly as it can be done. That's the key role of the healthcare PR consultant in trying to handle issues of this nature. I've also got a teenage son, Ollie, and Ollie seems to be popping up everywhere online, and you might actually wonder why. The main reason is that he's a good kid and he's out to help his dad, and his dad just happens to work in healthcare PR. So you'll see Ollie in a range of videos. He even got immunised on national TV.
More children than ever to be immunised against disease. That's the plan of a new national database. The revolutionary technology can tell parents just when their kids need a shot.
It's toddlers like Oliver this new program's targeting.
But these days, it's more about YouTube films and other types of social media content on issues like psoriasis, cough etiquette and other health issues. This is because PR professionals play a key role in researching, sourcing, finalising, posting and monitoring social media content. Our job is to help develop interesting content and then advise on ways to get that content shared, viewed, discussed and distributed. In many ways, that is totally consistent with what PR professionals have always done, and that is created content to try to integrate our clients into the daily public discourse. It just so happens that much of that discourse now happens online. Okay, so back to Mum. Mum's in her 80s now, so her eyesight is not quite what it used to be. She spends a lot of time consulting with her optometrist and also travelling into the city for her consultation with the ophthalmologist. So the question there is, what role might the healthcare PR team play in educating those who give advice to patients about their eye health? It's likely that there have been healthcare professional newsletters generated. It's possible that an overseas expert has been out to present at the Australian industry conferences. Much of that will have been leveraged into the relevant trade media. And so when Mary comes into contact with her optometrist, it's likely that that optometrist will have been exposed to a program which has been generated out of a partnership between a healthcare PR consultant and their client. Then there's my wife, Gab. She's making daily decisions for the family about what to use to treat our various ailments, our coughs, our sneezes, our allergies and our colds. And Gab wants to stay up to date, so she's reading the newspaper and she's reading all of the magazines. She's probably also consulting the pharmacist for some advice. Again, there is likely to have been a proactive PR campaign which aims to turn analgesics developments into news and to raise awareness among healthcare professionals and others about what they should be recommending at different times. And the role of the PR consultant is to use the new research and the various events to generate news which delivers maximum value for clients. My brother Steve, on the other hand, is slowly approaching retirement age, and so he's on the lookout for smart investments. And he's heard about an investment opportunity in a new Australian life sciences company. Now, the only reason he's heard about that opportunity is because a PR consultant is working with that company on a broader media relations campaign, the aim of which is to raise capital.
A small Queensland company that's developed a promising anti-cancer drug is now facing a new hurdle. Q-Biotics is trying to raise $10 million for human trials of a drug derived from a rainforest fruit. The scientists who discovered it say it's already cured hundreds of animals.
Steve is sold. He's now an investor in the company, and there's no way he would have found out about it without seeing the media coverage. Healthcare PR people are involved in lots of things, from proactive media relations to issues management, healthcare professional education, social media strategy development, broader health promotion campaigns, health-focused capital raisings, and a raft of other challenges that there is just simply not enough time to detail here. It's a challenging, fascinating, interesting world. And the consultants who work in healthcare PR feel like they're doing some good. They're raising awareness about diseases, they're helping charities raise funds, and they're playing a role in educating healthcare professionals about new treatment options. It's the kind of work that I've done just about my whole professional life. And so if you're interested in this area, as an intern, as a prospective client, as a student, as someone who works in healthcare marketing, I'd really love to hear from you. And also, feel free to check out our website.